Hello everyone. In this video, we are going to study about anatomy of stomach. This video will be uploaded in 3 parts. The first part will contain the basic structure of the stomach and its relation with the other intra-abdominal organs. Second part will contain the blood supply of the stomach. And the third part will contain the nerve supply of the stomach. Let's get into the video. Stomach is the most dilated part of the alimentary canal. It's in between the esophagus and the duodenum. It's a muscular bag. It's roughly J-shaped organ. But the shape of the stomach is considerably vary whether it's full or empty, with the position of the body, with the body habitus, and with the stage of the respiration. Okay, so here we have our stomach. This is the esophagus, and let's say here we have our duodenum. In between these two structures, we have the stomach. Okay, this is like this. Okay. So this is the structure of the stomach. The stomach has two surfaces, the anterior surface and the posterior surface, and also it has two curvatures. Here we have our lesser curvature. This is the lesser curvature and this is the greater curvature. Okay, the lesser curvature, there is a notch. Okay, this notch is called as angularis insulae. Okay, and there will be two orifices. We have one orifice which connect the esophagus and the stomach. It's called as gastroesophageal junction, which is called as cardia. And here it's cardia. And here we have another orifice which connects the duodenum and the stomach, which is gastroduodenal orifice, which is called as pylorus. Okay. So it has two surfaces, two curvature, and the two orifices. Okay. What are the parts of the stomach? Here there is a dome-like projection. This part, there's a dome-like projection from the level of the cardia. Okay, this part is called as fundus. Usually the fundus contains the air which we swallow. Okay, and here we have the largest part, the body. Okay, this is the body of stomach. What is the demarcation of the body? Usually we have already seen that there is a notch called angularis insulae. Okay, from cardia to angularis insulae there will be the body. Okay, and the distal to angularis insulae is the pyloric area. Okay, here there will be the pyloric antrum. Okay, it's the pyloric antrum, and there will be a narrowed canal-like structure. Okay, there is a narrowed structure which is called as pyloric canal. Okay, these are the parts of the stomach. Here we have the fundus, body, pyloric antrum, and pyloric canal. Here the first orifice, the gastroesophageal junction, the cardia, does not have a specific sphincter. There are some physiological mechanisms which prevent the gastric reflux to the esophagus. We will study the physiological mechanisms in a separate video. Okay, but here the pylorus, the gastroduodenal junction, has a specific sphincter which is made by the thickening of the middle circular muscles. Okay, so there will be a sphincter, specific sphincter in the pylorus, Okay, the sphincter is demarcated externally by a vein. The vein is called as pre-pyloric vein of Meyer. So, at the level of the pyloric sphincter, there will be a vein like this. Is called as pre-pyloric vein of Meyer. Understanding the anatomical relationship of intra-abdominal organs with stomach plays a major role during surgery. The organs which are posterior to stomach, which means the organs in lesser sac, makes the stomach bed. Let's say here we have the left kidney. This is the left kidney, and here we have the left suprarenal gland or the left adrenal gland. Here we have our pancreas. This is the pancreas. Okay, and here we have the spleen. This is the spleen. Okay, let's say here we have our ascending column. This is the ascending column, and here we have the transverse column. For a moment, I will draw it in the dotted lines. Okay, and here we have the descending column. Okay, this is the ascending column. Here the transverse column, and there will be the transverse mesocolon as well, and here this is the descending column. Okay, and there will be aorta like this. This is the aorta, and there is an artery called celiac artery. It's a short artery. Okay, immediately it will divide into three main branches. We will study about this celiac artery and its branches under the blood supply of stomach. Okay. Now it will divide into three branches, and this branch will continue as the splenic artery. Here we have the splenic artery, and here is the inferior vena cava. This is the inferior vena cava. Okay, and there will be the vein. Okay, the splenic vein, actually it is posterior to the pancreas. Okay, posterior to the pancreas, there will be splenic vein, and the inferior mesenteric vein will get connected with the splenic vein, and there will be superior mesenteric vein. This is the superior mesenteric vein. This is inferior mesenteric vein. So the splenic vein and the superior mesenteric vein will join to make the portal vein. So here we have the portal vein. There will be a branch artery here, which is superior mesenteric artery. Okay, these structures are posterior to the pancreas. Okay, now there is another important structure, which is the diaphragm. There will be the orifice where the esophagus enter into the abdominal cavity, and there will be the left crust, and this is the diaphragm. Okay, this is the diaphragm, and here we have our duodenum, and there will be the duodenum. This is the duodenum. Okay, so the stomach is like this. Okay, now the stomach is like this. Okay, so the structures are posterior to stomach. Okay, now we can see what are the structures posterior to the stomach. Here we have the upper part of the left kidney and left suprarenal glands, the spleen and the splenic artery, the body of the pancreas. Here we have the aorta and the celiac artery. Around the celiac artery there will be celiac plexus, celiac ganglia and the celiac lymph nodes as well. And there will be the transverse colon and the transverse mesocolon. So these are the structures which are posterior to the stomach, which make the stomach bed. Okay. Now what are the structures anterior to the stomach? Say here we have our liver, and this is our liver. Okay. So the left lobe of the liver is anterior to stomach. Okay, and the dome of the diaphragm will come like this. So the fibers of the diaphragm will come anterior to the abdomen as well. So the structures which are in anterior to the stomach are the left lobe of the liver, the diaphragm, costal margin and the anterior abdominal wall. So understanding this structure will definitely help during surgeries.